now. We do have a Q&A button available. We'll be answering questions at the end. We will also have kind of an engaging Q&A for all of you during the presentation. So feel free to type your answers in that chat box. You're all muted as of right now. I will be able to get you off of mute if you wanted to share your answers orally instead of typing in the chat. And it looks like we have Dr. Gaffney here too. So we have all of our speakers today. So I'm going to go ahead, jump to the next slide. So we are going to do some quick introductions from our speakers for today. As you may notice, Whit Downing is not here. I'm filling in for the fabulous Whit Downing. So I have big shoes to fill. She had something come up today and is not able to make it. So I'm Allison McCain. I am the Deputy Director with the Kansas Council on Developmental Disabilities. So I have the honor and privilege of working with Lola and Whit day in and day out. I also helped draft the Women's Health Guide that this webinar came out of. So this is very near and dear to my heart, and I'm excited to be sharing this all with you today. And I'm going to pass it to Jessie Danon.
I'm Jessie. I am with the University of Kansas Medical Center. I am an occupational therapist and a clinical research coordinator in our Division of Physical Activity and Weight Management program, and I specifically help run our research studies and programs in our community health improvement program for intellectual disabilities. So I am very grateful to be here today and excited to share what KCDD has done with this guide. I specifically helped draft the healthy eating and physical activity components of the guide.
Fantastic. Thank you for being here, Jessie. And Dr. Gaffney?
Hi, I'm Dr. Laura Gaffney. I am board certified in both internal medicine and pediatrics and have been here at Advent Health over 28 years. And I see people with special needs for across the lifetime. And I think this was a great project to take on. Very few states or institutions or anyone has ever taken this kind of project on. And it's important for women to know what to expect when they come to the doctor and how to participate in that to make it safer for them and to express information thoroughly yet concisely.
Fantastic. Thank you for being here and sharing your expertise today. And last but certainly not least, Lola Kernell.
Hi, everyone. I'm Lola Kernell. I'm the Advocacy Coordinator for KCDD. Supporting and empowering self-advocates is my passion. I am also a self-advocate diagnosed with Down syndrome and an author of this Women's Health Guide. Being part of writing this guide mattered to me because women with disabilities are often talked about when it comes to health, but not talked with. I wanted to help create something that feels clear, respectful, and honest, especially around topics that are usually uncomfortable or ignored. Together, we'll be walking you through the guide today, sharing what's in it, why it matters, and how you can use it in your work. We'll also be asking you to reflect and share because your role is a big part of how this guide can actually make a difference. Next slide. What's in my personal experiences matter just as much as our professional experiences. We bring everything we've been through to our jobs at KCDD, and that makes us much better employees and advocates. Next slide.
So, what is the Women's Health Guide? And I did drop a link in the chat if you are watching and want to kind of follow along and see the physical version of the Women's Health Guide. We have it as a PDF you can download. But we made this guide with input from women with IDD for women with IDD. We also included doctors and experts from across the state to help fill in helpful information about understanding eating healthy, taking care of your body, visiting the doctor, staying well, and more. Um, that means it's not just a bunch of medical advice on paper. We had women with lived experience share their input to really make it something that is easy to understand and it's not a bunch of medical jargon. Because, no offense, Dr. Gaffney, sometimes the medical language is really hard to follow and understand. So it's a combination of personal experience and expertise. So one big reason we created this guide is because information about health is not always accessible. Things like doctor's instructions, brochures, or even websites can be confusing and, like I said, full of medical jargon or big words that are often not defined. That makes it really hard to understand your body and your options. We talk a lot in this presentation about feeling empowered to really make your own decisions about your health. And you can't make those decisions if all of the words don't make sense. So that's what we really tried to do with this guide.
Another reason is that women with IDD are often left out of health education completely. Growing up, so much of this information was either not explained at all or explained in a way that didn't make sense for me. That gap can leave women feeling confused, scared, or unprepared for doctor visits. And finally, too many decisions about our bodies and our health care are made about us, not with us. That's why we always say, nothing about us without us. This guide exists to change that, so women can be included, informed, and empowered to speak up for themselves. Next slide. So, why are we here today? Why this webinar? First, women with IDD face real health disparities. We often don't get the same information, support, or access to care that others do. Second, healthcare can be confusing or overwhelming. Even simple things like understanding what will happen at a doctor's appointment or knowing what screenings we need can feel complicated if information isn't explained in a clear way. And that's where you come in. Whether you are a self-advocate with lived experience, a a professional who treats women with IDD, or a family member or caregiver, we all have a role to play in ensuring women with IDD have access to accurate women's health information. Next slide. Women with IDD face numerous challenges when it comes to their overall health and healthcare in general. That is why this guide exists. So here's our question for you. What's one challenge you've seen women with IDD face in healthcare? There are no right or wrong answers.
Feel free to drop your answers in the Q&A. Awesome. So looks like we have one answer says not understanding timeline and risks of sex and pregnancy. We have being talked over or about, but not with. I think Lola answered that up top too. Nothing about us without us. Not knowing what kinds of questions to ask for clarity. Doctors not respecting your voice, and you know your body best. Understanding what's being discussed, right? That's like all the medical jargon. Concerns of education about reproductive health could lead to preservation. The provider assumes that the patient knows what they are talking about and doesn't take the time to explain. Yes. The doctor not knowing about the diagnosis and its impacts. And then we've got more in the chat too. Having an extra ear to listen in the visits, the lack of holistic health education. Often the accessible education only focuses on physical health, information about menstrual cycles, dental care. Someone helps new moms and wants to educate. Not getting adequate care for menopause symptoms. Providers and doctors not accepting Medicaid or not being able to find doctors that accept Medicaid. Providers not allowing enough processing over time. Are other participants hearing an echo? Am I echoing? Okay, I've got some no and one yes echo. Providers not meeting people where they're at. This one says, is a parent going to new appointments and new doctors and having to re-go over history that's difficult to rehash? Also, periods starting early and no support to be found in their area. Okay, all really fantastic answers. Thank you all for sharing. Oh, we have some more in the chat. Assume that people cannot or should not fully understand sex and sexuality, making those decisions for people. Absolutely. A single diagnosis being the focus of a provider and missing other support needs like mental health needs. Definitely. Okay, all fantastic answers. Thank you, everyone, for being so engaging and responding. We appreciate that. Lola, are you ready for the next slide?
Oh, yeah.
Okay.
This guide has 6 sections. Those include women's healthcare overview and standards of care, what to expect during a doctor's appointment, staying healthy, eating right and wellness, reproductive health and preventable cancer screenings, requesting accommodations, and an annual checklist. Next slide. This is the first section of the Women's Health Guide, Women's Healthcare Basics. One important thing to remember is that women with IDD have the same health needs as all women. This section of the guide is meant to help women understand why routine healthcare matters, what to expect, and how to feel confident speaking up for themselves. Next slide.
Okay, we have another question for you all. One of the biggest challenges women with IDD face is understanding preventative care. Things like checkups, vaccines, or screenings that help keep them healthy before problems start. So here's our question. How do you explain preventative care to someone you support? There's no right or wrong answer here. We just kind of want to hear from you how you would define preventative care. Dr. Gaffney shares a good example in the chat. Brushing teeth so that your teeth don't fall out. Someone said screenings, routine checkups, dental, eye, hearing, and women's health. You have to visit the doctor often to make sure that you are keeping your body healthy. Fantastic. sharing information with them at their level and allowing the opportunity for them to ask questions. Doing what we can to hopefully not get sick, and that way we don't have to go to the doctor more often. Yeah, because no one likes going to the doctor all the time. Someone said vaccines. Actions taken to keep the mind and body healthy. Maybe something you do every day, or answering questions about symptoms you may or may not be having. Taking care of your body and yourself so you can stay healthy and feel good. All fantastic answers. Care that helps keep you healthy and happy. Washing your hands so you don't catch someone else's cold. That's a great example. Health is not always about treating a sickness or problem once they happen. Sometimes it's putting in some work before they happen. This may even stop them from happening at all. Awesome. Thank you all for sharing.
This next section of the guide is called What to Expect at the Doctor. It covers what happens before, during, and after appointments. Not knowing what will happen at a doctor's visit can be really scary. Even small things like what questions the doctor might ask or what words they use can feel overwhelming if no one explains them. That's why this part of the guide breaks doctor's visits into clear steps and explains medical words that doctors often forget to explain. The goal is to help women feel prepared, confident, and in control of their own health care, instead of being anxious or confused. Next slide.
Okay, I think I'm up.
You're up.
Yes. So, knowing what to expect at the doctor, when I was listening or reading what some of the people had said, one thing that would help is a health passport, which I saw mentioned, and we at KCDD are working on that. What we've called the meat and potatoes medical book. So I think there'll be some tools at the end to help. But what to expect at the doctor? You know, our job, but also our life skill, what we dedicated our life to understanding is trying to help people be healthy. So sometimes the first visit, we may not accomplish a whole lot. We may not accomplish everything that I want, and we may not accomplish everything that you want, but we have to start by building that relationship. And when we talked a little bit about communication, which is someone talking over you, someone talking down to you, that happens to everyone. And it's very hard to know, even when you're meeting someone in a general conversation in real life, how are they going to react? How do they express themselves? And when we're first meeting a patient, we have to start learning that discussion. So sometimes the first discussion, the first visit may not be the best visit. It also may be anxiety producing. But the point is that over time, we build a relationship, and over time, we build trust. So that's what that first visit is. That's step one. Now, number two is hard, reducing diagnostic overshadowing. And part of that, which I say is very, very important, and everyone on our team has heard me say this, is listening to what the patient has to say, but also accomplishing a thorough physical exam. Because a lot of people are diagnosed with things or not diagnosed with things because no one has ever looked. And having a physical exam from top to toe is what I'm talking about. Now, does that mean every part has to be examined at every visit? No. But does it mean within the first year of you coming to your doctor, a lot of things should be examined, even if it can be embarrassing? That's true. But we want to be accurate and we want to be helpful. And how can we reduce diagnostic overshadowing is actually by doing an exam. And again, that's getting to know each other. How do we build trust? How do we have that conversation and asking also, well, why are you checking that? But the importance is that patients need to understand that it is important to have a physical exam. The history and physical exam should tell the provider, the doctor, the nurse practitioner, the physician assistant, 90% of what is going on before any tests are done. The tests are done to help, whether that's blood draw or x-rays, but 90% of the information we should be able to obtain by listening to what you have to say, asking some questions back, and doing a thorough physical exam. Number 3 is promoting better medical care. So again, we may not be able to capture every single thing we want to say about anticipatory guidance, which is what we call it, or healthcare and preventive care during the first visit, because we might just say, here are the most important 2 or 3 things to talk about. But discussion of immunizations, also discussing what is found on social media does not constitute medical information most of the time. So there are reasonable resources that we can gain information from, and we can have discussion about what people view on social media, but that doesn't mean it's true, because a lot of things can be just like an ad and someone's trying to sell you something. So promoting better healthcare is also explaining what is going on, but also helping to explain some of the dangers that are out there as well. And number 4, supporting self-advocacy. You know, that's something we should be doing anyway for everybody, whether someone has an IDD or not, or whatever, which is that we have to decide what we can accomplish at each visit that's going to help your life. So a lot of times I will ask a patient, what are the 2 or 3 most important things that we accomplished today? What are the 2 or 3 most important things that you want to talk about? And again, they may say some things and we can discuss about that, but I may also say, well, here's the one thing I noticed that I think we should talk about too. So we have to have what we call dialogue, meaning that discussion goes back and forth between people. Does anyone have any comments? Or we're gonna just keep on going? That's right, Allison, move it through. All right, so it says here from me, in health education for people with IDD, accurate information is vital because it helps keep people safe, healthy, and in control of their own lives. Very important. And people think, well, now we have all these electronics and computers, and therefore it's going to have to be better. And the answer is sometimes it isn't. So sometimes a lot of false information gets in the record. Medications that the patient isn't taking. And I know it's kind of annoying, but when we also talk about the initial visit or any visit, people are asked to complete a whole 3 pages of written information, which are called social determinants of health. This is required by the federal government for us to do. It can be annoying. It can be irritating because some people are like, I have to fill this out every time. I just was here a week ago. I have to fill out the same paper. And the other thing, it's not necessarily written in plain language. So it's extra annoying and it takes up a lot of time of the visit. That information though helps your mental health, you know, and people should be paying attention to that. But we also have to go over a lot of things that are already present. And that is to make sure we're not having diagnostic overshadowing, that we're not having inappropriate diagnosis, but also including things that are important. And part of that is also assuring services. So let me think of it. So I'll use diabetes, which can happen to anyone, right? So if you have diabetes, it says to everyone in healthcare, you've got a healthcare problem that is more important than just having a general cold. But having that diagnosis also gains you services. It gains you a visit to a dietitian. It helps you with education. So it's important that we include some of those things that also don't pay me more, don't pay the healthcare center more, but are just allowing you to get services. The second section there is doctors need their patients to understand their own bodies accurately so they can give informed consent. So we talked about this dialogue of, do we have too many fancy words or not enough fancy words? And what a lot of people don't realize is that I had to take a class when I was in college called medical terminology. My daughter, who's in college in nursing school, is taking a class called medical terminology. So it is hard for people to understand what we mean because a lot of those words are originally Greek or Latin words that have been used across all languages, whether you're speaking Spanish or French or German, so that actually some of that can be internationally understood. So if I get someone's report from Mexico, I can actually read that report for the most part because it's written in medical terminology. So sometimes that's really hard because we're all speaking different languages, and then we have that medical terminology on top. But we also want to use, we don't want to be immature in our language, but we also want people to understand things well. So I'll give kind of a silly one, which is bowel movement. People are like, what does that mean? Bowel movement? What's my bowels? And then sometimes I have to use the word poop. Okay. But then everybody understands that. And it may seem like that seems very immature, Dr. Gaffney, but sometimes people don't understand what bowel movement is. So sometimes we have to use slang terms. Sometimes we have to use medical terms. And we have to have this going back and forth and looking at people's faces so we can read their understanding on their faces of what they're doing, which is sometimes hard for people to make good eye contact. But that's why we are trying to look at you. We're not trying to be intimidating, but we're trained to look at people. We don't want to disregard people. And then the other one is staying safe. So again, when we have accurate information, people stay safer. They aren't being told one thing that's wrong. They are being told things that are important because I've had many people not even know what their real diagnoses are. And when you know what's going on yourself, you feel empowered. You feel in control, and you are better able to get information and express your needs.
Now we want to hear from you again. Going to the doctor can be stressful for anyone, but it can feel especially scary for women with IDD. So let's think about this. What about going to the doctor could make women with IDD feel nervous or scared? And then how can you help them feel less anxious? There are no right or wrong answers here. Every idea is valuable. We want to gather strategies that actually work in real life, because even small steps can make a big difference in how comfortable someone feels at the doctor.
Okay, Lola, I'm going to say something, if that's okay.
Sure.
I would say one thing is I always try and introduce myself. So I say, hi, my name is Dr. Gaffney, and I'm here to visit with you today. And a lot of times I sit down in the little chair so that I'm more on the level of the patient or even below them so it doesn't feel intimidating. And a lot of times I'll start far away from the patient on my little stool and then slowly, slowly, slowly get closer. So that way they're not feeling as intimidated physically as if I'm intruding into their physical space.
I love that. Someone said the doctor's on your team and wants the best for you. When going to the doctor, not being believed about what she may be experiencing. This is a universal fear that all women have, not just women with IDD. Will there be shots? That does cause a lot of anxiety. I have anxiety about that. And finding out what will happen at that particular visit ahead of time can be helpful to have conversations um, ahead of time and to answer questions and make sure they know what to expect.
So I might suggest something. Sometimes we don't know if you're going to need a shot. I sometimes don't know ahead of time if you're going to need your blood drawn. But there can be tools that we can use to help people feel less anxious about that. And some of it is sensory input, and that can be used almost with like an ABA tool, like this is what it feels like when someone squeezes your hand. This is what the pressure feels like. There are times also where we can use some patches, and everybody should speak to their own doctor, their own providers about some of these tools about having your blood drawn, which can make it easier, including using some numbing medication before you come. So sometimes we don't know if you're going to need a shot or not, especially if it's the first visit when you're coming, because I have to review that. And sometimes we don't know if you're going to have your blood drawn. But you know what? If you don't feel comfortable having your blood drawn on that visit, you can always say, I can come back next week.
This one says they need to feel that they are safe. Past experiences may cause additional anxiety. Um, Uncomfortable talking about her IDD diagnosis and wants to be treated like everyone else. I try and set my daughter up for success and sometimes meet with the doctor ahead of time via email or phone about what are triggers and what she is anxious about.
Yeah.
Going, oh, sorry, Dr. Gaffney, did you have a response to that?
Yeah, I think when people talk about their female health or male health, to me, as a physician, I'm just talking about another part of your body as if I was talking about your nose. Your nose helps you breathe. Our female parts, how we pee. It's just part of ourselves. And so, sometimes it can feel very, we have cultural norms and how we talk about our private parts. And I will use the term private parts, but sometimes that's too vague and I have to use simple words. Sometimes I use very complicated words. And we want people to feel as comfortable about that as possible, but understanding that the discussion about sex, the discussion about private parts is something that we should all have with our doctors, no matter who we are, whether we have IDD or not.
I see Morgan Hodges has your hand up, so I put you off.
It's me, Greta.
Hey, Greta, do you have a question?
Yeah, I need to get off. I got a lot more stuff to do. Can we pick up on my phone?
Yes, you can call in on your phone. We also are recording it, so you'll get the recording.
Thank you.
Mm-hmm. Okay, I'm gonna go back to the Q&A. Someone said we use a notebook to write questions down before and then write the answers in the book during the appointment. That's great. Thumbs up from Dr. Gaffney. You can help by having conversations about what to expect and offer support either in the room or as an option to be in the room if needed. Talking with them, not at them, and listening to their concerns. I have someone who thinks the doctor is too nosy by asking about sex and potential pregnancy, and we've had to really talk about the safety concerns and medical concerns for why a doctor might want to ask those things. Dr. Gaffney, do you have any tips or tricks for that?
I would say, I want people I say it over and over again, just like we have in this discussion, just like we say in the book. We want people to be safe. Okay, so I am your physician, but I'm not your priest, as I will sometimes tell people. Well, okay, I couldn't be a priest either because I'm a woman. But in any case, we're not there to discuss a moral judgment. We want you to be safe and healthy. I'm not there to sometimes support or condemn behavior, but I do know what behaviors lead us to have health problems or can put us in both physical or emotional danger. And those are the discussions we want to have. We're not judging you. Maybe some people do, but that's not what our purpose is in asking some of those questions. We want people to be safe and understand how to help keep themselves safe.
And this is the last one. They have a fear about not believing the person about what they're experiencing, saying the person is ill or hurt because of their disability. And I think Dr. Gaffney kind of touched on that with the diagnostic overshadowing. So, Dr. Gaffney, do you have anything you wanted to add to that?
I think how we sense pain or how we sense what's going in our body varies from person to person, no matter what their diagnosis is or their underlying issues. Again, I think insisting on an exam when you feel unheard is important.
Awesome. Okay, thank you all for your feedback. I'm loving how engaging everyone is today. Lola?
Yay. The next section of the guide is all about staying healthy, eating right, and overall wellness, just like the title says. One of the things we love about this part of the guide is that it's full of visuals. That makes it easier to understand, especially if reading lots of text is overwhelming. For example, like the one on the slide here, there's a visual that helps women recognize when they're hungry, a physical activity pyramid showing different ways to move your body, and a healthy plate example to make balanced meals easy to see and plan. Next. These are the other two visuals that I just mentioned. These visuals aren't just pretty. They give real, practical guidance for everyday life. The goal is to make wellness something people can understand, use, and feel confident about without it feeling complicated or intimidating. Next slide.
Think this is my slide now. So staying healthy is not just about avoiding getting sick. Moving your body and eating foods that give your body energy are two very important ways to stay feeling good and well in your body. So if you can find ways that you actually enjoy doing this, it's much easier to stick with. So, my perspective on healthy eating and physical activity is to find things that you enjoy eating and find ways that you enjoy moving. So, the guide provides a lot of options for foods to choose from and how they give different nutrients or energy to your body. So hopefully there's lots of options that you can pick that you actually enjoy eating. So if you hate broccoli, nobody should be telling you to eat broccoli, but maybe there are some other vegetables or fruits that you enjoy eating that can give you similar health benefits. Same thing with exercise and physical activity. You do not have to get out there and start lifting 100 pounds or sign yourself up for a marathon. Maybe just taking the stairs instead of the elevator when you have an appointment or you're going to a building that has an elevator and you're only going up a couple of flights. You can take the stairs, doing a walk when it's nice outside. Dancing, putting on your favorite music and just doing like one song or two songs that you just move your body to. So that is my tip for this part of the guide is to really just find ways that make you feel good while you're doing it. And then hopefully you will see that that makes you feel good afterwards as well. You can go to the next slide. So next, I really just wanted to talk about the importance of having people with lived experience help create resources. So Lola touched on this at the beginning, nothing for us without us mentality. So I just wanted to kind of break down, especially when building resources, how people with lived experiences can play a vital role in that. So during the planning phases of a resource, people with lived experiences can provide insight on what the real needs and barriers are instead of someone outside of the community just assuming what is needed. When creating a resource, people with lived experience can help to ensure that the materials are accessible for all types of learners. And then when it comes to sharing resources, making sure that the people with lived experience are the ones presenting and sharing the resources provided. So this, I think, helps build trust between the people with all different abilities and their community providers. And it also empowers people with lived experience to continue to advocate and be part of resource development. So real quickly, as you could probably guess, this women's health guide followed this model pretty well. So Lola and Whit found a need because they had personal experiences and a lack of knowledge in this area, and they wanted a resource for themselves, and they knew that it would also benefit the community. So they helped in planning it. They knew the barriers that they themselves experienced. And then when we created this guide, they were at the forefront of making sure that it was in plain language, that they could understand it themselves, other people in the community could understand it, that we have lots of visuals and examples and activities to strengthen understanding, and then presenting and sharing this information. Lola is presenting it to her own community in this webinar format. So people who maybe aren't just going to pick up the guide right away have this verbal recording that they can learn a little bit information about it as well. So hopefully everybody sees the benefit of this. I think the going forward, any resource that is for this community should incorporate people with lived experiences input, and they should be part of every stage of the development and the dissemination of these materials, because that is how we have true improvement and knowledge transfer. So thank you, Lola and Whit, for putting this together and having this vision.
Thank, thank you, Jessie. Now let's pause and think about wellness in a real practical way. This guide gives tips and visuals for healthy eating, physical activity, and overall wellness. But what does that look like for the people you support? So here's our question. What are realistic wellness goals for the people you support? There are no right or wrong answers here. What matters is setting goals that are achievable, meaningful, and tailored to each individual. Even small changes can make a big difference over time.
Lola, do you want to share an example first? A wellness goal you have for yourself?
Sure. One wellness goal that I have is to incorporate daily exercise into my everyday life, which can be literally anything. I like to dance a lot.
Lola takes dance breaks at work. We love it. Try to eat a serving of fruit each day. That's a good one.
I'll say one. One of my patients, she had an amazing idea how to improve her health. is that in every room she went, she did a different exercise. So if she went in the kitchen, she would just do 10 arm lifts. Okay. If she went into to watch TV, she would do 10 leg lifts. And so that in every room where she entered, every time she entered that room in her home or her apartment, she did just a single simple exercise. And I just thought that was a really wonderful idea.
I love that idea. I want to do that.
So do I. Yeah, I'm gonna make a little sticky note
Yes,
on every doorway to remind me what I'm
right.
supposed to be doing.
Yeah. And it really has made a difference. She's gotten stronger and her endurance has improved. And I think that was probably one of the best ideas I've ever heard. And that came from her. I've never heard that come from any kind of healthcare professional or exercise expert.
That's awesome. Someone said eat fresh fruit or vegetables 3 times a day. Someone said they often teach the concept of habit stacking to the people they support. This means taking a habit you already have and pairing it with a healthy habit. So, for example, I already drink coffee every morning, so now I'm going to add drinking water or taking vitamins. Awesome. Okay, we're going to move on.
This section this section of the guide covers reproductive health, and another section covers preventable cancer screenings. We know this can feel uncomfortable to talk about, but it's also absolutely necessary. Women with IDD deserve accurate, clear, and respectful information about their bodies just like anyone else. Avoiding these topics doesn't protect us. It actually leaves us vulnerable. This section includes information about puberty, periods, pregnancy, menopause, and screenings like pap smears. It also shows practical steps like how to use pads and tampons in ways that are easy to understand. The goal is to give women the knowledge and confidence to care for their bodies, understand changes, and speak up for themselves in healthcare settings. Next slide, please. Women with IDD have been found to be about 72% less likely than women without disabilities to receive cervical cancer screening. Next slide.
Do you want to maybe touch on why this might be happening? I think we kind of set it up top. I don't know, Dr. Gaffney, feel free to jump in too. It's the assumption that you don't need a cervical cancer screening if you're not sexually active. And then I think sometimes people assume that women with disabilities are not sexually active. And I think that's a common misconception. I don't know, Dr. Gaffney, do you want to touch on that?
Yes, and I also think the term sexually active, what does that mean? And here is the thing, if I'll say a couple things. Number one, getting the human papillomavirus vaccine decreases the risk of getting cervical cancer by 95%, head and neck and throat cancer by 50%, and penile cancer by 50%. So that is very, very important. And not only can people be sexually active, which means have you ever had sex? Have you ever had intimate encounters with someone? That can kind of count too. So everybody does their own thing, and it's not that we're being nosy. We're just trying to say, well, how can we help you not get an infection caused by being physically close to a person, whether that is sexually transmitted or just avoiding a cold? Again, to me, it's kind of the same thing. You're close. It can happen. So one of the problems is that there is an infection, which is a human papillomavirus, that causes 95% of cervical cancers. And unfortunately, people who may also be vulnerable. We know that a lot of people are victims of sexual abuse or assault. They can unfortunately have that experience, which can also lead them to having a higher risk of having cancers. So it's important that we talk about it and that we be appropriate in our conversation. So it's about safety. It's also about where you are in your own life. Sometimes it's the provider that doesn't feel comfortable asking those questions, which is something, we have to be our own advocates in this discussion as well. And if that provider does not feel comfortable, we'll then say, all right, I'd like to see a gynecologist, and ask to have that kind of a referral placed so that you can get that. Another thing is that some women who have IDD, general flexibility can be difficult, and it can be difficult for them to have that exam. But we have to take the information from the individual and adjust our screening exams for cancer that are appropriate for them and what they feel comfortable with, and understand that maybe the very first visit we meet is not the time to do that exam. We have to gain trust. Some of the things we can also do is have an exam bed that is more comfortable for people to have the exam done. There are also now self-pap tests, which are basically just a swab that can replace, for lower risk of cancer women, having to have a full pelvic exam to check for cervical cancer. But there are different cancers of the female organs that are at higher risk in different times of our life. So sometimes one screening exam may be appropriate for when you're 20, but a different screening exam may be more appropriate when you're 45.
Thank you, Dr. Gaffney.
This part of the guide shows practical, everyday information that is often overlooked, but really important for women with IDD. For example, there is a social story about how to change your pad. It might seem simple, but knowing how to do this confidently is a big part of independence and personal care. Many women don't get clear step-by-step guidance, so visuals like this makes it easier to learn and remember. There's also a graphic explaining different colors of vaginal discharge and what they might mean. This helps women understand what's normal and what might be a sign to talk to a doctor. Knowledge like this keeps women safe, informed, and empowered to advocate for their own health. Including this information in the guide is about respect, dignity, and giving women the tools they need to care for their bodies without fear or shame. When I first learned some of this, it was confusing and a bit embarrassing, but having clear visual guidance would have made a big difference. Next slide. This section of the guide is all about power. It teaches women that they are allowed to ask for what they need, and those accommodations are a right, not a favor. Too often, women with IDD are told to just make do, or that asking for help is being difficult. Well, this section flips that. It gives clear examples of how to ask for support during doctor's visits, what accommodations might be helpful, and how to speak up confidently. The goal is to give women the knowledge and confidence to take control of their healthcare experience so they feel respected, understood, and safe. Next slide.
Okay, so now let's talk about how you can use this guide. One of the most practical ways is during pre-appointment prep. For example, you can review the section on what to expect during a doctor's exam, which is section 2. Um, you can walk through each step ahead of time, and this can help reduce fear and make the appointment feel a little more predictable. You can also role play questions a doctor might ask. Practicing in a safe space helps women feel confident to speak up and answer questions during the actual visit. I also wanted to highlight something that someone dropped in the Q&A. They said their OBGYN and I think it's a parent caregiver agreed that it could be helpful for their daughter to actually watch their well woman's visit. They think it would be really helpful for when the time came for hers. So I think that's a great example of role playing and modeling. And then finally, the guide includes a My Health Journal, which is found in the back of the book. Using this guide this way helps turn healthcare appointments from something intimidating to something manageable, empowering, and even predictable. I want to also share when we were writing this guide, we had a really fun day where Lola, Whit, and I went and had a mock doctor's appointment at Dr. Gaffney's clinic. And it was really insightful. We got to kind of see all the tools that might be used during cancer screenings. We took pictures of different tools. We also we had like our phones recording kind of the conversations. We role played a little bit of questions doctors might ask you during your visits, and that helped inform us as we were writing this as well. So it was a very fun day. I don't know, Lila, do you want to add anything about the mock appointment we had?
I have nothing else to add.
Okay, perfect. This is you, Dr. Gaffney. Do you want to talk about the importance of women with IDD having the My Health Journal or kind of a health passport with them when they go to appointments?
Yes, again, we have a health passport or journal, but we don't have a health passport encyclopedia, meaning that we want to keep the important things up front and important. And we're working on that in other ways within the KCDD to help express ourselves. But we like to keep our name, what's our birthday, so we know how old we are, because again, some of those tests and immunizations depend on how old we are, and what your preferred name is. Because sometimes I will say, I'll give you an example with my own name. I like to be called Laura. I don't like to be called Lori. I don't like to be called Laura. I like to be called Laura. So just making sure that we express ourselves so we can feel comfortable that we're using our correct name. And if possible, put your picture there. Then we also use communication tools. Do you use, if you need to have sign language interpreter, we will get you a sign language interpreter. If you need a different language that's your first language or your most comfortable language, and you speak Arabic, then we find an interpreter for you. And then the other thing what are the things that are important to you? Now, that's going to change at every visit, because you're going to feel the first time you come, you're going to have some questions, and the next time will be different questions. And so it's important to write those things down so you don't forget. So we make sure that we cover the things that are important to you.
Another way you can use this guide is as a teaching tool. This is where you help women learn, practice, and apply the information in real life. For example, you can review Chapter 3, which is Staying Healthy, Eating Right, and Wellness. Talk about things like balanced meals, recognizing hunger, or ways to stay active, using the visuals in the guide to make it clear and easy to understand. You can also go through Chapter 4, Reproductive Health, which covers, again, puberty, periods, pregnancy, and other important topics, helping women feel informed and confident. Don't forget the chapter on preventative cancer screenings. You can explain why screenings like pap smears and mammograms are important and what to expect. And finally, the guide includes an annual checklist, which can be a helpful way to review what's been done, what questions someone may have, and what's coming up next. Using this guide like this turns it into a hands-on resource, not just something to read. It helps women learn actively, build confidence, and feel prepared for their health care. Next slide.
This section focuses on using the guide to support advocacy. One of the most powerful ways is to review Chapter 6, which is requesting accommodations during exams. This teaches women that they're allowed to ask for what they need and helps them lead their own care. You can also use the guide to discuss finding resources and supports, like someone you can bring to your appointments as a support person or local programs that can help with healthcare questions. This guide works really well for small group activities too. I think I saw someone on here was tuning in with a group watching. You can role play different scenarios like asking a doctor for accommodations or talking about healthcare concerns. You can also help the people you serve come up with questions to ask their doctor ahead of time and write that down. I think we had someone in the chat say that earlier. They wrote it down in their journal and then they had the answers next to them during their appointment. By using this guide this way, you're not just sharing information, you're helping women take charge of their health. And if you're a woman with IDD, this is empowering you, hopefully, to take charge of your own health and feel confident going to the doctor.
This guide can be used in pieces. You don't have to go cover to cover or chapter to chapter. Use the section that matches the need you have. Next slide, please. Now we want to hear from you again. You've seen what's in the guide and how it can be used for pre-appointment prep, teaching, and advocacy support. So here's the question. How could you use this guide with someone you currently support? There are no right or wrong answers here. Anything that helps someone feel informed, confident, and prepared counts. We'd love to hear a few examples from your experience.
I think this question is also, it could be, how could you as a woman with IDD use this guide as well? And I'll kind of jump in, I guess, to start. It helps with awkward conversations because you have this guide in front of you. Sometimes when you're talking about things that might feel uncomfortable, it gives you a place to start and really helps open the door and make folks feel comfortable because you have this shared resource in front of you. Someone wrote that they are supporting someone with an upcoming dentist appointment. Lola, you also have a dentist appointment today, right? You can use this guide to role play asking any questions ahead of time so that you're prepared. Someone also said they plan to sit down with their daughter as well as her other support systems to discuss how they can all be on the same page. It's a fantastic idea. Someone said they'd like to be able to send this guide to their clients. I did want to say the link that I dropped in the chat earlier takes you to our webpage where you can download it. There's also a link to order physical copies. We ship them to you for free. So if you are wanting physical copies, because I know I like to have physical versions, we can ship it to you. So feel free to order it that way. It is not yet available in Braille. But I see you, and we will be pursuing that. We're also pursuing the Spanish translation of this guide as well. Someone else mentioned the Oral Health Kansas My Dental Passport. That's a fantastic resource. I don't know, I think Heidi said that. Heidi, if you're able to, could you drop the link to the My Dental Passport in the chat too? And yes, we ship anywhere in the United States. So some of you guys might be on the Missouri side, or in other states we can ship to you as well. Someone said they want to add this to their current curriculum and share with the University Medical and Counseling Center. That would be fantastic. These visuals in the guide are helpful tools to explain concepts that are difficult to describe and can reduce anxiety. I recently tried to explain what cervical cancer screening was, and I know this guide will help with the continuing conversation. That's fantastic. Thank you, Heidi, for dropping the link. Someone said this is so wonderful. There are visuals so that you can share what they may see at a doctor's office, the vocabulary that the doctor may use, and be able to pre-teach the vocabulary. Yes, and we do have like vocabulary sections for each chapter. I know we can't have every single word that you might encounter in a doctor's visit, but we do have it for each section. Can you put the link in the Q&A? No. I think the link for the oral health passport's in the Q&A. I think that's what the question was. Okay. All right, so some key takeaways. And this was Whit's slide. Again, I'm filling in for Whit. So I'm going to be kind of quoting her slide notes as we go through this key takeaway section. But lived experience matters. I think we really tried to put lived experience first when developing this guide because Lola, feel free to chime in too. Having the experience from Lola and Whit and other self-advocates who helped contribute to this guide really brought up different topics that people without lived experience weren't aware of as we were developing it. And then plain language is powerful, and that healthcare should be respectful for all.
This guide is about dignity. Women with IDD deserve care that is kind, clear, and respectful, just like anyone else. Next slide. I have really enjoyed learning about women's health. This guide and its creation have impacted the way I advocate for others and how I take care of myself. Health is essential for everyone, so we must advocate for it in every way possible. As a woman with a disability, I want other women and other people to be safe and healthy. The Women's Health Guide does just that in plain language, without the fear, confusion, or stress. I also have navigated the world as someone with a disability, and it can be hard at times, especially when new things come up.
Awesome. I'm going to quote Whit. Whit said, as a woman with IDD, I've experienced firsthand how confusing healthcare can be and how easy it is to feel left out or not taken seriously. Being part of creating this guide gave me the chance to turn those experiences into something that helps other women. It's been empowering to know that my voice and my perspective matters, not just in theory, but in real, concrete ways that can make a difference in someone's life. I've learned how important it is to speak up, share my story, and advocate for myself and others. This guide isn't just a resource, it's a reflection of our experiences, our knowledge, and our right to be included. Helping create it has reminded me that people with IDD can be leaders, educators, and advocates, and that our contributions have real impact. I needed to quote Whit because it was a fantastic response. I don't know, Jessie or Dr. Gaffney, did you guys want to provide any feedback on your experience drafting this guide, contributing to the guide?
I'm just really grateful to be included. I am really excited to use this guide with the people that we serve. I think for me, it was really eye-opening, like I said, to really see from Lola and Whit and the other people within the community the information that kind of has been lacking and having it all compiled in a cohesive um, place. So I think I'm just really grateful to be a part of the experience, and I think this will be a really valuable resource that I am excited to use with the people that we serve.
I feel very proud of it. I think everybody who contributed should feel very proud of it. And what's amazing to me is I've shared it with other organizations within the medical community, other clinics, other national medical resources. They don't have this. They were like, "What? Wow, this is amazing. Look at the pictures. Look at the descriptions. Look at the reflection that was done by the participants." And there never really had been anything like this that included the voices of people who it actually affects.
Oh, sorry. I called on you a slide too early. I also dropped the link again to the health guide in the chat. So if you're still not able to access it, please let me know. So the link takes you to the webpage where you can download the guide. And then if you keep scrolling down to the bottom where it says get the guide, that's where you can fill in the order form with your address and how many copies you need. And then we'll ship it to your physical address.
You can't go back and change the beginning, but you can start where you are and change the ending. I love this saying because it's so true, and it's really relevant to the advocacy you bring. We can't go back and change past experiences, whether that's times someone felt ignored, confused, or left out of decisions about their health. But what we can do is start where we are, right now, and help shape better outcomes going forward. Every conversation you have, every time you explain something clearly, every time you support someone to ask for what they need, you are helping change the ending. And that's powerful. You are in a position to empower the women you support to feel confident, informed, and respected in their health care. You can help them advocate for themselves, prepare for appointments, and understand their bodies. The guide is a tool to help make that possible. But the real change happens because of you, the support, guidance, and encouragement you provide every day. Next slide.
Okay, we've got about 15 minutes left, so we're going to open it up for any questions and answers that folks might have. Feel free to type in the Q&A, type in the chat, or if you want to come off mute, you can raise your hand and I can take you off mute to ask your question.
I am going to make one comment, which is that people are saying, "Where's the men's health guide?" Okay, that's our next project.
We need some men with lived experience to step up to help us write it. We've got a volunteer. Drew Duncan says he's willing to help write it. We're going to hold you to it. Okay, we've got a question. This is going to be for you, Lola. Could any of the individuals with lived experience comment on your thoughts about how to navigate the required medical forms and paperwork at visits? And I don't know, Dr. Gaffney could probably answer this as well. Lola, how do you navigate all of the paperwork?
So, so I do as much as I can and what I know. Sometimes I may have sometimes I may need some help from like a parent who is with me, but I mostly do what I know, especially since I'm 21 now.
Yes. Dr. Gaffney, do you have any tips that maybe you share with your patients on navigating the paperwork? Oh, you're muted.
Okay. Again, it can be annoying because people will say, well, I filled that out last time. I filled that out last time. Well, unfortunately, we are legally required to have people answer certain questions and fill out documents every time. People should make sure, because we're running into this in my own clinic, your guardianship paperwork is brought to the first visit and scanned into the record. If we don't have that and someone is your guardian, then they can't be seen. So we need to have that paperwork present. Number two, you should always bring your insurance card and a form of identification if you have one to every visit. Number three, if you have a question, you can always say, I don't know what the answer to this is. I'm going to have to take it home or have someone else help you. And as far as the forms that are required from the state, we've worked on that. We have a new health assessment form for the first time in 30 years that is available. Allison, is it available on our site yet?
Not yet.
Okay, so we need to put that on there. And that is going to replace a lot of the forms the CDDOs have because it is safer and more informative. You can all make sure you please, if there's a form you leave for us, please put your name and date of birth on it because we get a lot of forms and we don't want to lose your form. And please try and get the forms to us as soon as you need them, not the day of you needing them. So I think there's the two parts, which is the forms you have to fill out because you have to come and the forms you have to leave because of what you need to have done. And then I'm going to read this here. This one, it says, how do you help guardians understand that their individual has the right to their body? I have a situation where a mom doesn't want her daughter to even be asked about sex or anything. This is the reason why mom doesn't want her daughter to go to the residential. She's convinced they give the girls birth control shots. I'm struggling to get mom to understand concerns are valid, but her individual is an adult and has the same right as her and I. So again, I think there's questions that we can ask about female health that are birth control, there's menses, there's cramping, there's the cycle. So there's a difference between birth control, even though we say birth control pills a lot. But there's a difference between having birth control and having abnormal periods or problems with periods. We cannot force someone to be sterilized. Okay? That is against the law. A guardian cannot make a person be sterilized. The individual still has to express that want of permanent sterilization. And some patients I have who are women have requested that, have had discussions with me multiple times and their family members and gone to court and requested to have permanent sterilization. And the court has supported that because they were able to make their own decisions, even if they were under guardianship. So they were able to discuss it and decide that. But we cannot force someone to be on birth control pills. We cannot force legally anyone. But to not have the discussion is to say that you aren't important enough to have the discussion. about your period. That would be us like not discussing how you breathe. It's part of your biology, and you deserve the respect to have the discussion.
Okay, I'm not seeing any more questions. All right. Well, I'm going to click to the next slide. Here you can find the email address for all of the speakers today. I want to also say thank you everyone for joining and contributing to the conversation. I really appreciate all of the comments and questions and answers throughout the presentation. So thank you all. This is a very important conversation and we're so grateful for your participation today. I'm also grateful for our speakers, Dr. Gaffney, Jessie, and Lola, and your contributions to this guide. It's an incredible resource, and I'm so excited to share it to self-advocates across Kansas and in other states. So if you want to contact us, please do so. This is also going to be recorded and uploaded to our website on that same page that I sent earlier where you can find the Women's Health Guide. Please order those and download your PDF versions. And we're here for you as a resource. So thank you all for participating today. All right. Thank you all so much. Have a great rest of your Wednesday.